So here is the questionnaire, and this is a paper form of it.
Also paper form or working all shop question or paper ma je jata apnara paisen.
For those that like it on paper, but if we go online, here are the questions. And the first question is checking whether you're doing it yourself or whether you're doing it for somebody else.
So pehla question gero ilo ki apni apna lagi kor raha hai na aadhar lagi kor raha.
People can fill it in now, can't they?
People can fill it in now as well if they want.
Yes.
They've got their forms. If you've got your forms with you now, you can
Yes.
fill it in now. So we know that parents for little babies and young children might well do the questionnaire for them.
Akin ejon maya ki tar bachcha lagi ba ejon bape tar bachcha lagi kor ita question.
And we also know that there are now more carers in the country than people that work in the NHS.
So when I can care was and then care to feel like different care for that can I do it important.
So we always want the patient to try and do the questionnaire themselves.
Akin apa sign akin doctor of the sign je gari nijor question nije korta hai na parle tin kalkulta.
But if they're not able to, or if they don't understand English, then it might be that they ask a carer or somebody else to do it on their behalf.
Akin help with the property nije na korte paro ino je help korte paro.
Because we are keen that everybody can benefit from this and not just the lucky few.
Akin shop ek good benefit ni taki.
And if you are doing it for somebody else, you just tick the no box and you write down your name and what your relationship is with the person that you're doing it for.
So jodi apni apna lagi koren na akin te gari ugo maje normal je thik korta ba dar apna naam lekhta ar apna relationship ki ta akin tumhara care ni na ma ni na ba.
As a practice, our role is to check with the patient to make sure that they're happy for the carer to do it for them.
Akin tara as a practice akin tara go jantoi ba patient ke sai digo thik ase ni tara.
Because we believe that this is part of caring.
Doctor ni bishas hoy digo tar part of patient caring.
So the next question says, do you speak English? And that's because all the information that we provide is written in English, and it's one of our checks, because if you don't speak English, then we start to wonder how you've understood the questions.
Akin go ile gari apna English ko joni ha jodi hoy na te go akin doctor janta sai ba je kila apna pucha question.
And one of the reasons we're doing this video today is because for those people that don't speak English, they can hear Shafia, so they can understand what the questions are about.
So amra ko aske pora akin je jodi apna question gula bujoi na jami bujiye dilam akin.
So the next question asks, are you happy to use passwords to access your medical records?
Apne happy asen je password use korta access record kor.
And that's important because we want you to be happy that we're using passwords for you to be able to access your records.
Akin amra doctor sai ra akin je apnara khushita akin bushta happy asen je I question gula apnara buchhu.
So if you don't trust passwords, then this might not be for you.
So password je apna bishas hoy na te go korta na.
And that's an important principle because although we might think everyone should have access to their records, there might be some people who actually don't think it's right for them.
Jotona ni doctor apna ni go shobor akin kora usit but ko apnara iguna ni opinion ase je sign ne jodi korta na kora korta pata.
And we want to give you the best opportunity to understand the issue so you can decide for yourself.
Akin balati ke buicha korta.
And you can do this whether you speak English or not.
Akin go korta parba English matni na matni.
And you can do that whether you're an adult or even a young child.
Akin apne boro manush ni na choto bachcha go still kora jay.
Because you might have asthma, diabetes, eczema, or depression and anxiety, and it affects all of us.
Akin apna je kono rogo thake na apne akin go buja buste parba.
So the next question says that after you've been to the doctor or to the hospital, you can check if the encounter's been recorded and what was discussed. Do you agree this is a good reason to have access to your records? This is essentially saying that this allows you to be able to see what the doctor or nurse has written about you in your record.
Nego ono maje record maje data parba akin je apne doctor na ile hospital on maje keson kital lagi har kital lekho ise.
And that's important because we want you to know what it is you're signing up for.
So you are very important and very important akin je kital lagi apne sign up for.
And then the next question asks, would you like to feedback what you think of the records access system? And that's because the only way we can improve things is if we can hear from you and find out what you think too.
Akin ego amra rekhoi akin doctor rekhoi ta je feedback dita ki ego kichu improve kora jay je bero kai go beshi difficult ni na beshi hard ni na kila je comment aile ba ego improve korta.
And that's a really important principle because all of us are wanting the NHS to be the best it can be, and the only way we can do that is if you also feedback and tell us what you think too.
এখন তার সাইডে এগুলো সব থেকে বেস্ট ফ্যাসিলিটি দেওয়ার লাগে আপনারা প্রাইভেট যদি মনে করেন এগুলো যে আপনারা কমেন্ট এগুলো ভালো করতে পারবেন.
And then there may be an instance when accessing your medical records online, you may read some information that could be shocking or upsetting. What do you do if this happens and you can't speak to your doctor or nurse immediately?
কিন্তু যদি আমার কিছু দেখোই না কেন অনলাইনের মধ্যে যে আপনারা আপসেটিং করে আপনি এগুলো খুশি না দেখি তারপর যদি সার্জারি একটা টাইম বন্ধ.
And you've got a few choices and you can choose whichever ones that apply to you. So you might choose not to look at any test results and wait until you've seen the doctor or nurse, or you might panic and get worked up, or you might want to look at some reputable websites like NHS Choices, or check the self-care section on our practice website. Or you might choose to wait and contact the practice the next working day, or contact 111, the free NHS telephone service where you can speak to anybody 24 hours a day, 7 days a week, or you can contact the out-of-hours service, or you might choose to go to casualty.
Okay, so আপনার এখানে চয়েস আছে যে ফার্স্ট ওয়ান হইল গিয়ে রিজাল্ট একটু দেখতা না ডাক্তারের লাগি ওয়েটিং করতা নাইলে পানিক করতা বসে থাকি পানিকিং করতা নাইলে জানলা না কিতা করতা. নেক্সট ওয়ান হইল ওয়েবসাইট ও NHS ওয়েবসাইট থেকে দেখতা আর ইনফরমেশন এগুলোকে বা নাইলে ওয়েটিং করতা যে সময় ডাক্তার খুলে গিয়ে ডাক্তারের লাগে মাপতা বা ফোন করতা জানাইতা নাইলে 111 ডায়ালিং করে দিতা. Contact out of our service contact করতা নিনা এনি যেমন দিছে ইত্যাদি.
What are your thoughts about that?
So you contact করবা মনে করেন.
You've never heard this before, have you? What's your thoughts about this? If you saw something that was shocking or upsetting, and you couldn't book an appointment and speak to your doctor immediately or nurse, what would you do?
I think I would contact 111.
Okay.
If I was really distressed.
So if you read something that your doctor or nurse has written in your notes, and let's say it's 2 or 3 weeks ago, and you don't know why they've written that or what it means or whatever, and you ring 111 up and you speak to somebody on the telephone, what do you think they're likely to say to you when you ask them why has the doctor written whatever it might be?
I would think if it was something that had been written 2 or 3 weeks ago, and I was still I felt okay.
Well, but you're shocked and worried. If you're okay, and support. What do you think 111 are going to say to you?
I never phone 111, so I don't know. But I would hope that they would just reassure me and say, you need to make an appointment and see your doctor.
Correct. That's right. Absolutely. And similarly, when we're thinking about, well, would you do anything else besides 111? Oh, anybody else, not just you, anyone. What about if you went to casualty? I come across a lot of young people, particularly, and when I ask them the question, often they're teenagers and in their early 20s, their immediate response is, well, I'd go to A&E. So, you're a young person. What do you think about that?
I don't think I'd go straight to A&E. I know the burden on the A&E, the long waiting times. I'd probably check a reputable website first, try and find out the information myself.
Yeah.
If that doesn't work out, then my next resort would be to dial 111.
Okay. And as we've just said, that 111 might not be able to answer the question, so where else could you possibly consider?
In that case, if 111 was no help either, then I'd try and book an appointment as well with my GP.
Yeah, and most problems usually can probably wait. And remember, this is the GP record you're looking to, so usually, most of the time, it's contact the practice. And that will take some of the pressure away from all the other services who are trying to deal with everything else as well. And
I think number one just needs a bit of thinking about, because the question talks about when you've seen something shocking or upsetting. And there's the other stage, isn't there, which is if you are expecting some information that might be difficult to handle, some test results or something like that, you can decide not to look at all until you've had an opportunity to wait until the doctor's available and speak with them then. So you don't need to look at something on your own if you're expecting something that might be tricky.
Absolutely. Or the other things, of course, is, and if we think about panic and get worked up, which I often come across patients like that, the question I would ask is, When's a bad time to look at your record if you're a panicky sort of person? Which day of the week? Friday. What time Friday? Not quite 5 o'clock.
6 o'clock.
6 o'clock or 6:30 when the surgery closes. Because if you've read something at 6:30 and the surgery's closed, and even if you ring 111 up and they say, well, you need to ring your surgery, you've then got that whole weekend to be sitting there worrying until you can get hold of the GP. So if that's a bad time to look at the record, when's a good time?
Sunday night.
Sunday night, what time?
I don't know.
What sort of time on Sunday?
I don't know.
Because you know that you can, it's Monday morning at 8 o'clock you can call.
Right, so when would be a good time? If you know that you can call at Monday at 8 o'clock in the morning, when's a good time to look at your record?
Monday 7 o'clock in the morning.
Yes, well done. Why 7 o'clock in the morning?
Because you don't have long to wait until you can call.
Correct, well
So
done.
if you look at it Sunday night, you might like use the program and stuff like that.
So that's exactly what I say to patients who say they're panicking. It doesn't mean that they can't have access to their records, but it says, please don't look at your record on a Friday night. Or if you're a sort of person who's got family and you need people around you, then make sure there's people around you so that if you do start to become anxious and panicky, you've got someone that you can talk to. Do you want to say briefly in Bengali, just to explain?
Okay. যদি কোনো জিনিস এখন প্যানিকিং করেন আর আপনারা এগুলো হ্যান্ডেল করতে পারেন না মনে করেন যে দেখো রাতে ফ্রাইডে না দেখিয়া উইকেন্ডও না দেখিয়া সকালে দেখবা সকালে গেলে এখন তখন বেশি যদি কিছু থাকে কেন আপনারা প্যানিকিং করবা যখন ভালো ফাইডা না দিব বা কিছু বাদ রিপোর্ট আইসে তখন ডাক্তার লগে লগে কিছু কিছু করে দিতে পারবা তো সকালে এখন মন্ডে টিউসডে মর্নিং দেখেন এখন উইকডেজ সকালে
And similarly, Richard?
Well, just what Ingrid said about these questions came up when I was working with the practice in Simondley, and they struggled with the fact that you say when you've seen your record, what would you do? It then says not view the test results, which you've already seen them, and quite a few people actually were quite irritated by that. So I was thinking that possibly we could say that you might be upset when you see things and then have that question, so a decision you might make is not to, and then have the second statement and then maybe move on to the second bit, because it was actually I had quite a fight about that. So it's just a thought that maybe there's 2 stages to this. The first one is you might be upset when you see your data, so maybe you prefer, this is one option, not see the results at all, but wait till you see the doctor. But if you are going to see them, what would you do if you? I just wonder if that might. It was a bit confusing, wasn't it?
It's interesting. As far as patients are concerned, there's a lot of patients who actually just want to look at the records, in which case it's not an issue. So why would we not want to look at it, especially if you're signing up for the service? But then there's a lot of people who also I've come across who, when they are worried and frightened, actually say even though they might be able to do these things, actually choose not to. That's what that's been my sort of experience of that. But yes,
there's confusion about that. I think it is a bit confusing because it actually says what do you do if you see your results. You can't, if you've seen your result, not view your result. It isn't a really option. That's all I'm saying. So maybe just two steps.
Yeah. Okay. All right. Now then, the next question. So you look at your record, and you've not been to your GP surgery for a long time. You've not been to the hospital or anything, and you suddenly notice there's a letter there that you don't know anything about. So you open it up and you find it's about another patient and all their details. What do you do? Read it, then tell everyone else what they suffer with? Inform the practice, or stay quiet and not tell anyone?
Okay, so other question I look at আপনি প্রতিদিন মাঝে ডাক্তারের কাছে না তখন একটা তখন অনলাইন বক্সের মাঝে আপনার একটা ইমেল লেটার আইছে তখন এগুলো কি তা করবা যদি এগুলো ফইরা না নেই তখন যদি আপনার নাই সেগুলো ফরবা আর ফরবা নি না প্র্যাকটিসে ইনফর্ম করবা ডাক্তারও ফোন করে হইবা যে সেটি আমার নাই না কিছু কইতা নাই কইতা বা
ডাক্তারকে কই
she's saying that she will call the doctors and inform the surgeon.
Okay, very good. Can you imagine some people choosing that they wouldn't want to tell anybody?
কোনো মানুষ আছেন যে কইতা চাই না আইসে সো কি কইলাম তাহলে
I don't have a problem with whoever.
It's better to tell people it might be someone else's this is important even as come to the person.
Correct. You're absolutely right. But sometimes people are scared that if they tell the surgery that there's an error, that someone's going to get into trouble.
কোনো সময় কেন কেউ ডরাই না যে সার্জারি কইতাম কিনা তাহলে যদি আমি ট্রাবল করি
And they might think, let's not tell anybody because I don't want somebody losing their job.
কেউ যদি এখন হাম যায়নি বা যখন এখন ফেডোয়াইলা হইতাছে সার্জারি
But we don't want people to be fearful of that because we know that errors can happen with anybody. I make mistakes myself all the time. And actually we'd much rather you tell us the mistake so that we can fix it.
ইলা যদি বলো যে ডাক্তারে খোয়া বালা তখন তারা একটু ফিক্স করলো ফিউচারের উইথ না বুঝতো যে সারো
And this is about the partnership of trust that I talked about earlier.
এগুলো কিন্তু পার্টনারশিপ অফ ট্রাস্ট এগুলো কিন্তু দুইজনের আন্ডারস্ট্যান্ডিং ইয়ার এখানে আছে
Now then, would it upset you if you read something somebody else has said about you with regards to your health?
এগুলো আপনার অ্যাকসেপ্ট করবেন যে আপনার শরীরের হেলথের কথা অন্যজনে মাত্রে
Do you understand what that means?
It's not very clear that you just say that.
Anna? Does anyone understand what that means? Do you understand what that means?
I'm thinking, are you thinking that if the doctor had written, they thought I was a worried, well person and didn't really believe what I was presenting with? Is that what?
So let me give you an example of what I mean by that. So sometimes patients find this one difficult to understand. Let's suppose that you've been under a lot of stress, you've had a lot of extra responsibilities put on your shoulders at work, you've got children, you've got family, you've got bills to pay and all sorts of pressures and things, and you've not been sleeping very well. And because of that, you've decided that you're drinking a couple of glasses more of wine or whatever it might be, just to try and help you with sleep. And 1 or 2 glasses soon becomes half a bottle of vodka, and your partner's worried about you, and they're saying, now come on, you need to cut down your alcohol. And you're like, you don't know what pressures I'm under, and I've got this, that, and the other, I've got lots of responsibilities on my shoulders, and the whole world will fall apart if I don't do X, Y, and Z. And so you're not listening. And then you decide that you're going to book an appointment with the doctors because you've got a sore throat or something. So he knows that you're coming to see me, but then he rings me up and says, by the way, Dr. Hannon, I just want you to be aware my wife's been drinking more than she should. So it's where somebody else, it could be a neighbour, it could be a friend, it could be a family colleague, it could be a work colleague, who rings up the surgery because they're worried about you. But you know nothing about that. Of course now, you log into the medical record and you can see that so-and-so's rang and snitched on you. Does that make sense?
Yes, yes.
So, would it upset you if you read something somebody else has said about you with regards to your health? No? Yes? I don't know. Do you want to just explain?
Okay, so you এটা ডাক্তারের ওখানে কইতাছে নাকি যে আপনার রেকর্ডের মধ্যে আপনার শরীর খারাপ বা আপনি একটা জিনিস লুকাইলা ফ্যামিলি থেকে বা আপনার হাজব্যান্ড বা ফ্যামিলি মেম্বারকে ওয়ার্ড ডাক্তারের ফোন কইলা কইলাইছেন ওয়ার্ড আপনি কি তাহলে চিন্তা করা ডাক্তার আপনি রেকর্ডের মধ্যে দেখতে পারা তখন গেলে কি আপনি এগুলো চিন্তা করবা না করতা না কিন্তু তখন এগুলো
In the Bengali community, because of course many of us don't really drink alcohol, but it presents in a slightly different way. Imagine that your wife or your daughter is pregnant, had a baby, and has developed postnatal depression. She's very depressed, and she's acting bizarrely, and you don't know why. And it's a very difficult time, and you might be worried that if we approach the doctor's surgery, that they'll take your wife away and they'll put her in a hospital and they'll diagnose her with a mental problem.
Okay, so এগুলো এখন হইতেছে যদি এখন যেমন ধরুন আমরা কমিউনিটির মাঝে একজনের বাচ্চা আছে মহিলার বাচ্চা হয়েছে বা তাই নাকি একটু ডিপ্রেশনের মাঝে আসেন বা তাই নিজেই হইতেছে এটা নাকি জানি তান্ডে করতে কিনা ওই যে মেন্টাল হসপিটাল ওরা কিছু তো এগুলো লাগে আপনারা গ্যারি এগুলো খিলান থাকেন ওখানে.
So if that person, that wife, that daughter, then looks at the medical records and finds out that you were the one that actually told the surgery that you were worried about.
So আপনি না নিফন হইরা বালা হইলেছেন আপনার ফুলের কথা বা বড় কথা যে ওলান তাই এখন বহু কন্ডিশন তাই তখন গিয়ে আপনি একটু দেখলা দেখে আপনাদের এগুলো খিলান যোগ করবা.
How will they feel about it?
এখন আল্লাহ এগুলো খিলা ফিলিং করবা.
What do you think? Would it upset you that someone else has said something about you? No, yes or no? Excellent. So she's chosen don't know, and a lot of people choose don't know because it depends, doesn't it? Because on the one side, it's possible that you've got an alcohol problem and we need to deal with it. But on the other hand, it's possible that your partner, you've fallen out with them, and they now want to destroy that relationship that you have with the doctor, so they're making you out into an alcoholic.
Sicuramente quando ডাক্তাররা একটা রিলেশনটা ভালো থাকতো না পরে ইমপ্রুভ করা হইতে পারে যে আপনি ড্রিঙ্কিং করা.
So these are very sensitive issues and very difficult ones that people around the world are struggling with. However, inside the practice, how we've dealt with this is by asking this question, and if you come across something in your record that you don't agree with because somebody else has said something about you, then contact the practice and speak to one of the doctors.
এগুলো এখন সব জায়গাতে এগুলো দুনিয়ার যে কোনো জায়গা বা আপনি যদি এগুলো দেখেন কিছু অনলাইন বা এগুলো আপনি খুশি থাকেন যে তবে ডাক্তারের সাথে ফোন করতে ডাক্তারের.
And if you have a different viewpoint, then at least we can write in the records that you disagree with that.
যদি আপনার অন্য ভিউ থাকে এগুলো তারা চেঞ্জ করতে পারবো.
And if you're the person who is giving this information about somebody else, then tell the doctors what you want them to write in the notes.
আপনি ডাক্তারের কইতে পারবেন যে ডাক্তারে কি তাহলে তার রেকর্ড রয়েছে,
knowing that one day that person might be able to read what's being written.
ও মানুষে হয়তো এগুলো দেখতে পারবে.
And you might choose to say, don't say where it's come from, that there's an accusation. Or you might say, no, put it down, wife says that husband's been drinking too much. And by being explicit and clear about this, then there's no misunderstanding afterwards. And then final, the last question is, do you feel you understand what record access means? Do you all feel you understand it? Because that's the questionnaire done. Okay.